guys, welcome back to my channel. So guys, you're welcome to my channel. If you are new here, you are highly welcome. So for those of us that are new in this channel, the name of my channel is Toju Talks Nursing. On this channel I talk about nursing vlogs, health tips, and a little bit of finance. So guys, if you want to know more about what this channel entails, then please do subscribe to my channel and don't forget to click on the notification bell to let you know each time I post a new video. And those of you that have subscribed, thank you guys for subscribing and welcome back to my channel. Guys, today's video is going to be about the things that aspiring student nurses and intended nurses ought to know before they become student nurses or nurses. So these tips are going to be beneficial to this set of people. So guys, if you want to know about these tips and be informed about them, then do keep on. So guys, one of the things that you need to know before becoming a nurse, especially as a nursing student, is that it entails financial responsibility. Of course, becoming a student is not an easy thing. You have to spend money, especially in this part of our continent, Nigeria. You have to spend a lot of money, from paying your school fees, especially for those that are attending private school of nursing or those attending private university. Their school fees is on the high side, so you have to spend money. Apart from your school fees, there are other things you need to spend money on, like your accommodation. Of course, some schools do not have accommodation for their students, so a lot of people look for accommodation outside the school campus. So I'm getting an accommodation, especially in this part of the world, is very not easy at all. So it's also very expensive. So you should bear in mind that as you are going to becoming a student nurse, or you are going to be entering into the school of nursing for the nursing program or into the university, you have to spend money on your accommodation, on your school fees, on your feeding as well, taking care of yourself as a student, as well as other things that comes along even during the course of your training, like your exam fees, textbooks that you need to buy to study, and all of that things, everything that you need. In fact, your transport from your campus to the school, from your hostel to the school, everything that entails you to actually, successfully and concentrate on your study needs finance. So that has to be sorted out before you think of becoming a nursing student, because if this is not sorted out during your process or your program, it will actually distract and take away your attention and your focus from your study. This will not help you at all. For instance, and during exams, you're asked to pay exam fee and you don't have the money forthcoming. It will distract your studying time, because without the payment, you will not be allowed to write your exams. And if you don't write your exams, how do you pass? If you don't pass, how do you become a nurse? So these things have to be put into consideration before you think of becoming a nurse. Now let's go to the next. Number 2 thing that you need to know before you become a student nurse or a nurse is that nursing is time consuming. Yes, I said it. Nursing is time consuming. Nursing is not one of all those other courses that you just think and you go to class and 2 hours you are done and you come out of it, or you just go today and you just do just one course or 2 courses and boom, you are done for the day. No, nursing is not like that. So you should bear in mind that nursing is going to take a lot of your time. Your social life is going to be reduced from 100 to 0, if not 1. So you should put that at the back of your mind, that you don't have time for shit. You don't have time to yourself. You don't have time for play. You don't have time for enjoyment. So because nursing is a serious business, from waking up in the morning 8 a.m. to be in the class, you close your lectures around 2 to 3 p.m. and then you want to do tutorial or extra classes from 2 or 3 to 5 p.m. and then you want to you are assigned to the ward, you may likely be assigned to the ward, then you want to go to the ward, you are being put on a night duty, you still have to wake up in the morning from your night duty and come to class in the morning from Monday through Friday, and even sometimes Saturdays and Sundays. So with all this at the back of your mind, you should know that nursing, you are not going there to play. It's a serious job. So that should be at the back of your mind when going in for the nursing program. Next thing that you should know before you become a nursing student or a nurse is that nursing is not glamorous. Nursing is not an influencing job. So if you want to become that glamorous girl, an influencer, a makeup pretty girl, a Miss World and Miss Beauty pageants, then nursing is not for you, because in nursing you barely have the time for all that. You barely have the time to even wake up and do a proper makeup on your face. You barely have the time for that. So if you are into all that, then the nursing is not for you, because in nursing you have to come across a lot of things that may be nasty to you, from coming in contact with blood, patient's blood, coming in contact with mucus, coming in contact with pee, coming in contact with poo, coming in contact with secretions that are nasty and messy. Some even have to bathe your body with vomitors. Patients have to bathe your body with vomitors. A lot of things that you will not like at all. So be prepared and be rest assured that as you're going into nursing, you are going to be coming across all these things a lot, especially during your clinical posting. And you don't have to make that face like, oh, she just vomited. No, you have to you have to still go wipe a patient's butt when the patient poo, for patients that cannot do that themselves. So there are a lot of things a lot of better things that you as a nurse has to do during your nursing program and during the period of you being a nurse. So you have to put all that into consideration. So of course that is the job of a nurse. So you should know that that is what you will come in contact with before becoming a nurse. From what I've just explained, even when you have the time to put on a clean and a beautiful makeup, make your hair, this makeup will maybe wiped off immediately you get to your nursing practice area in your hospital. You can just come with a fine makeup and a patient just come in and poo on your body and wee on your body and just vomited on your body. And what do you have to do? You just have to go wipe off, and you don't have time to do a re-makeup again. Apart from that, in nursing they don't allow a long hair, because you might be in a ward, a psychiatric ward for instance, where a patient can come in and drag that long hair, and that will be detrimental and harmful for you. So it is not allowed that you carry a long braided and wavy or coily hair as a nurse. It's only allowed that you carry a low cut or a very low weave on or wig, as the case may be. Apart from that, we're not allowed to put on high heels, because high heels can actually disturb our patients while we work during our clinical posting. So you don't want disturbance for the patients, because you are on high heels. You are on high heels making koi as you are moving around to see your patients. You don't want them to be disturbed. You want a peace and a quiet environment for your patients. So it is only allowed that you put on a low shoe, as the case may be. So apart from of course you don't wear slippers. You only wear a low covered and neatly and nice shoe as a nurse. And also you're not allowed to put on dangling earrings. All those things that you see as beauty out there, in the nursing profession, they are not allowed. Dangling earring, a patient who is psychiatric in quotes also can as well come and drag it from your ear, and this will hurt you a great deal. So it's better you just put on your pin hearing that it's just there in your ear, or not even put on an hearing at all, as the case may be. So that is one of the things you should be abreast of before you become a nursing student. Another tip I'm going to be telling you guys today is that as a nursing student, you have to study. If you don't study, then you cannot pass your exams. Nursing school is tough and difficult, although not very difficult if you study hard. So you have to bear in mind that you need to study. You have to study as a nursing student. So that is what you have to do during your period of training. And the study time, you have to pick a good study time for yourselves. Personally, I do my readings during the day. Some people are comfortable doing their readings at night, early in the mornings, during the day. So pick a good study time for yourself. Another thing I would advise that you do as a nursing student is that you should pick a study group. Study group is one thing that is very beneficial. Very, very beneficial. A group of persons come together and explain or teach or tutor themselves to understand a particular topic. So do this every day during my period of training as a nurse. So I advise that you choose a group that you'll be studying with each day after each classes every day, because this will make it very easy for you to pass your exams. If you keep your courses, you want to keep it and wait till exams before you read, then it will be very cumbersome for you to do, because the courses are so much that if you begin to pile them up, you may find it difficult during your exams period. So don't keep and pile up your classwork until exams. Try to read on a daily basis. You can pick an hour or two after classes to read those things that have been taught on that day, and maybe 1 hour for the study group each day. This makes it easier during your exams, because the courses in School of Nursing, a day you can have up to 6, 7, 8 courses, and during exams all these courses are combined and you have to write them during exams period, and they are so voluminous. It's something that is, in fact, it's not an handout, so it's something that is a whole textbook that you have to finish and write during exams. So for it to be very easy, you have to make sure you read every day, each and every day that you are being taught. A topic that you are being taught today, make sure you read it as the days goes by. As you have done for that day, try to pick a time to read for that day to make everything easy for you. The fact remains that nursing is not a joke. People's lives are literally kept under your care, so there is no room for any form of mistake or lackadaisical attitude. So you have to be serious and be focused as a nursing student, because we don't want to leave any room for any mistakes, because human lives are involved in this case, not like other courses where human lives are not involved. Then you can play with those courses, but for nursing, you don't have to joke with your work. You don't have to joke with your study. So you have to make yourself available for study and to learn. And during your clinical areas, don't assume you know things that you don't know. Even the slightest of things, you should ask questions. You can never go wrong with questions. Ask questions even when you feel ashamed of it and you think you are supposed to know it, and you are thinking of how people will react. So that you ask questions to know than to make mistakes, as this will be detrimental to the life of a patient. So please, serious and try to study. Apart from that, another thing that has to ginger you to study a lot is that as a student nurse, people tend to ask you a lot of questions. They tend to trust and put a lot of confidence in you. Some even refer to you as a doctor, a surgeon, and a qualified nurse that you are yet to be. But then you cannot even tell them, oh, I'm not a qualified nurse yet, I'm just a student nurse. You still have to answer their questions. Even when you tell them you are a student nurse, they still you are still a nurse. You are in the process of becoming a nurse. So to me, you are a nurse. So they tend to want to still ask you, and they believe and feel that you should know what they ask you, because they feel this is general thing that should be known, as a nurse. So because of this, you have to make sure you are, your feet are on deck your hands are on deck to be able to meet up to these questions that people tend to ask you during the period of your training as a nurse. And how do you do that? Is by way of reading and being versatile in your knowledge so that you deliver when you are being asked. That I'm going to be giving in this video of the thing that you should know as a student nurse or a nurse is that you should know that death is what you will come across throughout the period of your life as a nurse. So if you're that type that has death phobia, then nursing is not for you. You come in contact with patients, you lose patients under your care, and you have to prepare these patients for the morgue, and you have to take them sometimes to the morgue. You have to bed bath them and do a lot of things. Is something that is inevitable. So at the end, you have to learn to cope with that situation. But if you think you cannot cope with it, then nursing is not for you. So that brings us to the end of this video. So if you like this video, give it a thumbs up, then like this video, and then for you that have not subscribed, what are you waiting for? Please subscribe to my channel and click on the notification bell to let you know each time I post any video. So guys, I'll see you up in my next video. Bye.